Hey everybody, welcome back to another episode of Facebook Live. Tonight we are here at Newsom High School as the Newsom Wolves take on the Haines City Hornets. We are joined here tonight by a very special guest, sports medicine specialist Dr. Eddy Echols. Dr. Echols, first question, how you doing?
I'm doing well. Hey, it's a beautiful day, beautiful evening. It's football time. What can be better than that?
Absolutely. Dr. Echols, you are a sports medicine specialist with a primary interest in shoulder and elbow care. There's a lot of talk out there about sports-related shoulder pain, shoulder injury, but maybe one of the less commonly talked about topics are elbow pain and elbow injuries as it relates to sports medicine. So are you seeing a lot of elbow-related or sport-related elbow injuries on a day-to-day?
Well, I think you have to quantify that. Obviously, depending on the sport, not so much in football per se, but baseball, you see a lot of elbow injuries. As a matter of fact, Tommy John is one of the most commonly referenced injuries, one of the most commonly seen injuries in baseball, and that's due to the mechanics of throwing. Football, not as much, but some of the things that we'll see more frequently than not will be sprains, and I think that's one of the things that we'll kind of get to. But tennis elbow, golfer's elbow, things like that are some of the more common injuries that you'll see in general, particularly the tendonitis and things of that nature.
Dr. Echols, we talked a couple weeks ago with our sports medicine director about sports medicine in general, and we learned that you don't necessarily have to be an athlete to see a sports medicine physician. So with that said, are there any non-sport related elbow injuries that you see? Are those common at all?
Well, I would tell you that actually probably the more common entity of an elbow injury is going to be non-sports. And to that end, you'll see dislocations, you'll see fractures and things of that nature, which usually are going to emanate from falls or trauma or things like that. Obviously, you're going to have certain generations that are going to be more prone to injury than others. As we become elderly, we become a little more frail and firm, and you're more likely to sustain falls.
So with that said, there's a ton of different elbow injuries. Are there any that are more common than others? Sprains, strains, elbow dislocations, or maybe even elbow fractures. Are one of those more common than the other?
Okay, so once again, I think you would have to quantify exactly what population or demographic you're referring to. Obviously, from the standpoint of sports, then you're more common to see sprains, strains, things of that nature. As I alluded to earlier, tennis elbow, golfer's elbow, which is ultimately tendonitis involving the extensors or the flexor muscles in the forearm, which are commonly aggravated in racket sports. Now, if you go away from sports per se, then dislocations and fractures are going to be more of the common entity because, as I said before, you have individuals that will fall, put their arms out to balance themselves, which will ultimately oftentimes end up with fractures or dislocations.
Now, Dr. Echols, the elbow is kind of, similar to the knee in the way it moves, joint-wise. Is the way that the elbow is structured rather, does that lead to it being more or less vulnerable to injury than maybe a joint type like, say, the shoulder or hip?
Actually, I would say that the anatomy in and of itself really does not play a role as to whether or not that joint is more prone for injury. I think it really comes down to the sport that you're playing. For instance, once again, baseball, the mechanics of throwing, they overload the elbow so that you'll see a significant amount of injuries in baseball per se. Conversely, the shoulder has a very wide range of motion, and therefore it opens it up to injury in multiple sports. But particularly take football. Football, you see a preponderance of knee injuries. So I don't think it's, quote unquote, the anatomy of the joint. It's more so the sport that is being played and the positions that joint is exposed to.
Now, Dr. Echols, I have a feeling we might have to quantify this one, but what's the overall treatment process for certain kinds of elbow injuries? Would you say that a lot of elbow injuries require surgery, or maybe some are more non-surgical, or is it dependent?
I would say the majority are non-surgical. The majority, once again, are going to be your sprains, strains, dislocations, and things of that nature, which routinely can be treated non-operatively. Obviously, if you have a fracture, then more times than not, that's going to require surgical stabilization.
And lastly, Dr. Echols, if an athlete or a sports medicine patient in general, we know that we don't have to be an athlete to see a sports medicine physician, once they make a full recovery healing-wise from an elbow injury, what's the likelihood that they'll be able to get back to 100% activity-wise, get back to their sport, get back to their hobby or whatever they were doing prior to elbow injury?
There's a high likelihood, a very high likelihood, particularly with elbow injuries, not unlike the knee injury. People routinely think of ACLs and those type of injuries. Well, a good percentage of those patients don't make it back to their pre-injury level of play, and that does not necessarily depend upon the injury itself. It's more so psychological injuries. Well, you don't necessarily have that barrier with the elbow per se, so that you can look at the results. We have a number of professional pitchers that undergo not one but maybe two Tommy John procedures and still come back and pitch. So we don't quite see as much of a barrier in return to sport with the elbow as we do with the knee and some of the other joints.
Awesome. Well, Dr. Echols, thank you so much for being here tonight.
Well, sure.
Thank you for your time. You sacrificed your days, your Fridays. Every week, Friday, you're here, protecting our Newsome athletes. So thank you for everything you do for our patients. For the folks back home, thank you for tuning in. Keep staying tuned in, and we'll stay keeping you active. Thank you.
See you later.